The next vital sign is blood pressure. Blood pressure is the measurement of the force of blood against the walls of the arteries as the heart pumps blood through the body. It is reported as millimeters of mercury, mmHg. This pressure inside the arteries changes when the heart is contracting compared to when the heart is resting and filling with blood. For this reason, blood pressure is expressed as two numbers called systolic pressure and diastolic pressure, e.g. 120/80. Systolic blood pressure, the top number of the fraction, is the pressure in the arteries during systole, i.e., when the ventricles are contracting and causing the ejection of blood into the aorta and pulmonary arteries. Diastolic blood pressure, the bottom number of the fraction, is the resting pressure in the arteries during diastole, i.e., the phase between each contraction of the heart, when the ventricles are filling with blood. Depending on your state's scope of practice for nursing assistance and the training you receive at the facility where you work, you may be delegated the task of taking blood pressure with an automated cuff. Be aware of the client's health status because there are circumstances when blood pressure should not be taken on a certain arm, such as an arm containing a fistula for dialysis, an intravenous IV line, or implanted birth control. If the person has had a mastectomy, blood pressure should not be taken on the arm on the side of the mastectomy. When obtaining a blood pressure, allow the person to rest in place for a few minutes, or an inaccurately high blood pressure may be obtained due to recent activity. Position the person in a seated position with their legs and arms uncrossed, and the elbow of their arm at heart level supported by a table or your arm. Lying down or standing will change the blood pressure reading. So document if the client is standing, sitting, or lying down when the blood pressure is measured. Raise the client's sleeve or assist the client to remove their arm from their sleeve. Place the artery marker on the blood pressure cuff directly on the skin above the client's brachial artery. To find the brachial artery, gently flex the arm and feel for the bicep muscle, which is the larger muscle of the upper arm. The brachial artery is located towards the inside of the base of the bicep muscle. See the different sizes of blood pressure cuffs. In adults, regular or large cuffs are typically used based on the size of the client's upper arm. It is vital to ensure the cuff fits appropriately on the person's arm in order to obtain an accurate blood pressure measurement. An undersized cuff will cause an artificially high blood pressure reading, and an oversized cuff will produce an artificially low reading. When applying the cuff to the client's arm, the end of the cuff should be within the indicated range margins on the cuff. See above for an image of the range designated on the cuff. If you are using an automatic blood pressure monitor, place the cuff. After the cuff is in place, press the start button on the monitor. The cuff will automatically inflate to a specific pressure and then deflate at a rate of 2 mmHg per second. The monitor digitally displays the blood pressure reading when it is done. See the image of an automatic blood pressure monitor. Abnormal blood pressure readings should be promptly reported to the nurse. Blood pressure, BP, is categorized into 3 ranges: low blood pressure, hypotension, normal blood pressure, and high blood pressure. Hypertension, HTN, in general, 120/80 mmHg, is considered a normal adult blood pressure reading. See blood pressure ranges for adults for categories of hypotension, normal, and hypertension in table. Systolic and/or diastolic blood pressure readings outside the normal range should be immediately reported to the nurse.